I would now like to welcome to the stage Dr. Beata Biok, the President of the Australasian Faculty of Occupational Environmental Medicine, to present the Ferguson Glass Oration.
Thank you, David, and tēnā koutou. The Australasian Faculty of Occupational and Environmental Medicine's keynote lecture was named the Ferguson Glass Oration soon after our incorporation into the Royal Australasian College of Physicians and as part of our efforts to showcase our history and pay homage to our founders. The oration is named after Professor David Alexander Ferguson AM and Professor William, affectionately known as Bill to us in the faculty, Ivan Glass. In the early years, both David Ferguson and Bill Glass attended their jointly named lectures and were duly acknowledged as the two founding fathers of academic occupational medicine in Australia and New Zealand. Both David and Bill were pioneers of the discipline. Professor David Alexander Ferguson graduated from the University of Sydney in 1942 and spent some time as a GP at Narromine in New South Wales. He was a revolutionary physician, a man with unfashionable concerns for his time, and who wrote his MD thesis on stress and health in telegraphy. He was the first professor of occupational and environmental health in Australia and set up a diploma in occupational medicine at the University of Sydney. He was one of the founders of the Australian College of Occupational Medicine in 1982 and was the college's second president from 1985 to 1987. He passed away unexpectedly in 2002 at the age of 81. Professor William Bill Ivan Glass is in his 88th year and lives in Wellington. He passes on his apologies at not being able to be here today, but our faculty was very privileged to have him fly in for the day yesterday and present at our stream. Bill graduated from the University of Otago in 1956 and 2 years later set sail for London. His mentor at the time, Dr. Chris Wood, Senior Lecturer in Occupational Health at the London School of Hygiene and Tropical Medicine, advised that he enrol there. Bill became a member of the Faculty of Occupational Medicine in the UK in 1978. Bill was awarded the 2019 Senior New Zealander of the Year Award for his contribution to occupational medicine. For more than 60 years, he has drawn attention to unseen fatal effects of exposure to substances in the workplace. He created an asbestos exposure register. His efforts have resulted in improved health outcomes for countless workers by demonstrating the danger from substances like asbestos, lead and silica, and also organising methods for reducing and controlling those exposures. His work has been outstanding and inspirational. Professor Maureen Dollard, who will be presenting the Ferguson Glass Oration, I'm very happy to say comes from my state of South Australia. She is Professor of Work and Organisational Psychology and Director of the Asia Pacific Centre for Work Health and Safety, a WHO collaborating centre for occupational health at the University of South Australia, an honorary professor at the University of Nottingham. Her research concerns workplace psychosocial factors, and she has published extensively on the topic. Maureen is on the board of the International Commission on Occupational Health, the editorial board for Work and Stress, the Journal of Organisational Behaviour, and the European Journal of Work and Organisational Psychology, and the Advisory Board for Beyond Blue Workplace Mental Health Advisory Group. She co-established the Asia Pacific Academy for Psychosocial Factors at Work and is Fellow of the European Academy for Occupational Health Psychology. Maureen is the innovator of the Psychosocial Safety Climate Theory and applications, key benchmarking metrics of employee wellbeing, national surveillance of working conditions via the Australian Workplace Barometer, and bringing an economic focus to occupational health. It gives me great pleasure to invite Maureen to present the Ferguson Glass Oration.
Thank you very much, Beata. I'd like to thank the Royal College of the Royal Australasian College of Physicians and AFOAM for inviting me to give this oration, and I'd like to honour Professor David Ferguson and William Glass, the forefathers of occupational and environmental medicine in Australia and New Zealand. So I'm going to talk about, can you hear me okay? No, okay, so do I need to switch something on? How about now? Is that okay? Yes. Yeah, great, fabulous. I'd like to wander around. So I'm going to talk about the social political context of physician health, but more broadly, everybody's health, because what happens in society in terms of the health and well-being of workers often ends up in the medical system. So I'd like to outline the mental health costs of work stress, levels and causes of work stress generally and in physicians, and then talk about psychosocial safety climate theory and the evidence basis for it, look at the value of psychosocial safety climate in organisations, and then some solutions about what we think could be done. The scale of mental health issues globally is being described by many as a crisis. If you look at evidence on the WHO website, the ILO, or the OECD, they're describing mental health as a crisis and are calling for national policy responses to it. According to the WHO, the global burden of depression is on the rise. Mental health problems are a major contributor to the overall burden of disease, accounting for 21% of years lived with disability and so on. There's much evidence about this. In Australia, almost one in 5 people have had a mental health or behavioural condition, and suicide is one of the leading causes of death of working age people in Australia. One issue which is curious and something that I'm starting to look at is the relationship between work stress and antidepressant use, is that Australia has the second highest levels of antidepressant use in the world. And this is really extraordinary. Why would that be the case? We have an advanced economy. If it's going so well, why are people using so much antidepressants? Only 52% of Australian workers consider that their workplace is mentally healthy. So there's a huge opportunity for improvements there. And only 56% believe that their most senior leaders value their mental health. So this issue is doubly important for physicians because they are the go-to profession for workplace mental health problems. That's where people go to mostly to get information about what to do about this issue. Yet they are most at risk compared to many other professions for mental health related issues. So there's a recent review by Gail Kinman and Kevin Teo, which has been commissioned by the Society of Occupational Medicine, which provides a really comprehensive review on this topic. So I'd encourage you to do some reading there. But I've summarised some of the points in these slides, which would be available to you as well. The levels of distress among physicians is high. Doctors are at considerable risk of stress, anxiety, burnout, and so on. A survey by Beyond Blue suggested that 21% of doctors have reported ever being diagnosed with depression. And the risk of suicide, especially among general practitioners, psychiatrists and trainees, and among women, is high compared to the general population. I think you probably know this kind of information already. And the question is, why is this the case and what can we do? General practitioners are more vulnerable to burnout, work-related stress and so on than other specialties. And trainee and junior doctors are at particular risk of mental health problems. And so the question is, why are they experiencing distress at such early stages of their profession? And one of the problems is that because doctors are so, concerned and feel responsible about the kinds of work they do, they turn up to work when they are sick, and we call this presenteeism, and this brings another risk of maybe accidents and injuries as well. It's not good for your personal health and well-being. The causes of distress are always things like high workload, the growing intensity and complexity of work, and the rapid change in healthcare, and actually the levels of resources going down, like levels of control, levels of support, the time required to take care of people, and the personal experience of bullying and harassment is something that I frequently read about in this profession. The conflict between work and professional life is another issue that's constantly raised for this profession, and the implications of this is that we have increased problems in relation to turnover, people leaving the workforce, and the potential risk to patient outcomes, and not to mention the financial performance of healthcare organisations. And then another problem is stigma. Often doctors and indeed health professionals in general, I think, feel quite frightened to report the fact that they are experiencing distress because of the stigma and the threat to their professional status. Only 28% of doctors in Australia feel comfortable seeking help for mental health conditions. I had the opportunity to talk to some trainees earlier this week about what some of the stresses were that they faced. And these are groups, so there were groups of them, and I asked them to write down what some of the issues were that they came by. This is just a high-level summary, but the first and foremost, isolation and lack of support was one thing that came to the fore. They said, too often doctors feel alone and unsupported in decisions, which is very stressful. Another one was assessment demands. So, the exams and the expectations of the exams. Another one was balancing work, study and family, saying that these days often people coming into the faculty are older with families and how to balance all of that. And the constantly changing and unclear expectations of what's required of them, and so on. But it's the case that in any occupation there are stresses that people face. But the question is, what sort of communication opportunities are there for people to feed back into the system about what the issues are? Because each of these issues are modifiable, they are changeable, and it's just a matter of trying to come up with new solutions, and that requires dialogue and discussion with the people on the front line. So Michael Bajan, is he here? Nope. He wrote a very interesting piece for the Australian Medical Journal talking about burnout in the medical profession and arguing that it's not a rite of passage. It shouldn't have to be the case that people suffer burnout as a matter of course, and that there should be action taken to make sure that the profession is themselves working in healthy workplaces. And we've done some research in hospitals, and this quote from a nurse was really telling, I think. She was saying that she's been a nurse for 40 years, and that these days there's only like one day in 10 where she feels that she's had a really great day. And most of the other days she comes home, exhausted, under pressure, patients have been lashing out at her, this kind of thing. And doctors are working in these kinds of circumstances as well. And this is a result of the heavy workload, the reduced resourcing, and a lack of time for care. I think that work stress is an infinite problem under extreme capitalism, where there's unequal power, there's unfair resourcing. A recent book by Ian Ferguson talks about the link between the economic and political system that we live under, capitalism, and the extremely high levels of distress evident in the world today. It's a very interesting book if you have a chance to have a look at it. And even the Pope is talking about the perils of capitalism leading to poverty. And, every day we hear about the problem of the climate and how maybe capitalism, the idea of capitalism and the climate are incompatible. And the fiction of perpetual growth on a finite planet. Yesterday there was a UN report about the insatiable use of resources on Earth and threatening the species, many species on Earth. Recently, the International Labour Organisation commissioned a lot of so-called think pieces about the future of work. And if you would like to go to those, they're pretty interesting. We wrote one about work stress, the conundrum of work stress, and the idea that it's an infinite problem in the social political system that we are currently working under. On the hospitals, there's reduced resourcing. We're becoming more alienated from the people that we intended to care for. So the driving beat is economic rationalism. Everything we're doing is being argued about in economic terms. And the drummers of our social economy are the economists. And these are the economists of a capitalist kind. So we need more, we need to be thinking about this in terms of, the moral aspect, the kind of society that we want to live in. And there was another publication by the Society that talks about looking at economics, the moral factors, the social factors in making any decisions about society. So the cost to workers of stressful work is mental and physical ill health. The cost to organisations is sickness absence and reduced performance. And the cost to society is a loss of potential labour supply, high rates of unemployment, and a burden on the health system. So you guys are interwoven into each of these aspects. So the theory that I've been working on is psychosocial safety climate. I'll talk about it. But whenever we think about the individual that comes to see you, the one that we talk about, they're working in a job, in an organisation, in an external context. So I always like to think about the social determinants of health. And Sir Michael Marmot and his kind of philosophy is what has influenced my thinking in this field. A broader, I'm a bit scared to press any of these buttons. They're a little bit foreign, but let's go here, good. So if we look at worker health, which is here, there are so many different factors which can impinge on worker health. And if the worker turns up and is suffering from depression, it would be easy just to fix that problem. But we have to look at the person in the context of all of these factors. Starting here, the national political power relations. What's the level of union density in the Scandinavian countries where union density is really high? Worker health is much better, the working conditions are better. What are the social influences? And here, the Royal Australasian College of Physicians can be advocates for this problem and can influence here, which then influences labour market policies, welfare state policies, which can influence the kind of climate, psychosocial safety climate in the organisation, which can then affect worker health, not to mention the kind of working conditions that we find ourselves under. All of these things are by human design. Somebody decides the demands that you're going to face. Someone decides the resources that you're going to get. Australia spends $60 billion per annum on defence. And wouldn't it be good if that was a bit more funnelled into health and well-being and better jobs? So psychosocial safety climate is a concept that we've come up and addresses this conflict about whether or not the management are concerned about your mental health versus their concerns about productivity and profits. Psychosocial safety climate offers a point of resistance to these kind of pressures, capitalist pressures. Psychosocial safety climate refers to shared perceptions regarding policies, practices and procedures for the protection of worker psychological health and safety. So you guys will be familiar with safety climate in high-risk industries, like the oil industry, for example. So it's the same as that, but it's really focusing on the psychological health of workers, not just the physical health. So we developed a measure which has 4 different components: management commitment to psychological health, the priority given to psychological health in the workplace versus productivity and profits, communication about psychological health issues, and the opportunity for participation and involvement in psychological health issues. And like these are the kinds of items that we've got. The first one there, senior management shows support for stress prevention through involvement and commitment, and so on. You can have a look at those. So we developed this measure, and this is how it works. A lot of the work stress theories that you might know about start with the assumption that work stress comes from the way the job is designed. So if you've got too many demands and not enough resources, you'll probably start to become distressed, and then that in turn can lead to burnout, and then in turn depression or anxiety. So, but the question is, like, where did the demands and the resources come from? So we started to think about this. And so our innovation was that if we know about the psychosocial safety climate, then we should be able to predict the kinds of demands and resources that people get, and then the psychological health of the workers, levels of engagement, and then these outcomes like safety outcomes, accidents, injuries, so on. So psychosocial safety climate we considered as a so-called cause of the causes of work stress. So that's a Michael Marmot thing, the cause of the causes. And so if we know about psychosocial safety climate, we understand the values of the senior management and what sort of concern they will have for the psychological health of workers, and then what kinds of work are on offer. It could also moderate the effect of the relationship here. So the first study we did on this was in the Victorian the Victorian Education Department, and we aggregated psychosocial safety climate to the school level. So we asked everybody those questions, we aggregated the data, and then we found that we could predict work pressure and exhaustion over the next 12 months, controlling for baseline levels of this, and we could predict resources, learning opportunities, and engagement over the next 12 months as well. So this was really good because in work stress, and some of you already told me that work stress is in the eye of the beholder. This shows that you can look at a climate and understand a climate and then predict individual reactions to that. So beyond the individual perceptions, we can see that there is a climate that's working here. And this one of remote area nurses, it was a longitudinal study, and the work is so demanding for the nurses that there's a huge turnover. So our longitudinal design was disrupted somewhat, and everybody that was here at time 1, or most had left by time 2. So how would we handle our longitudinal design? Well, we theorised that if it really is a climate that we're talking about, it didn't matter who was really reporting it. Even though these nurses left, these were different people, we could still predict the same kinds of things over 2 years. So psychosocial safety climate predicted future workload. It predicted future emotional exhaustion in different nurses. So this was pretty compelling evidence. I can see that we're running down on time, so I'm having to go a little bit faster. But here we could see that we could predict circulatory diseases from psychosocial safety climate 4 to 5 years later, over and above other kinds of theories of work stress that focus on job design only. So really finding good evidence of this kind of upstream social determinant of work stress. Here, a study among in the health profession predicting registered work injury and, importantly, underreporting of work injury. If we know about psychosocial safety climate, we probably find that people are not reporting injuries like they should be, and so on. Happiness, it predicts happiness. One really interesting thing is that in a work unit, like a ward on a hospital, we find that leaders, the yellow ones, report PSC leadership behaviour to be a lot better than the other people in the ward. So there is a mismatch between how the employees are seeing the situation and their leaders. So there's an opportunity for dialogue right there. What's going on and how could we improve that? And it also predicts bullying and future policies and procedures in relation to work stress prevention. And you know, the revolutionary study coming from New Zealand about the 4-day working week was all over the papers, and it was in Australia. You know this one? Yeah. What drew our attention to it was the fact that they used psychosocial safety climate to evaluate the impact of it. And they found that psychosocial safety climate for these workers increased following the implementation of the 4-day working week. So the practical value of psychosocial safety climate, so you know, we do need to put a dollar value on some aspects of our work to convince people that it's a good idea to take this work seriously. But we've been able to derive benchmarks for psychosocial safety climate. If we eliminate low psychosocial safety climate, there could be a 16% reduction in depression among workers in Australia, for example. And then we can also put a dollar cost on each of the levels of PSC, because we can put a dollar value on hours lost and so on. And so we estimated that the total cost of low psychosocial safety climate to employers in Australia is $6 billion per annum. And in the Australian public service, across 100 public sector agencies, as psychosocial safety climate increased, sickness absence decreased. And this is one that says that if you know about psychosocial safety climate of the workers, of the organisation, you can predict future return to work time and dollar cost. So what can be done? Going back to Kinman and Teo, they talk about some things that we could do for physicians. More support is urgently required to help improve the mental health of doctors from recruitment to retirement. They say that available support should reinforce help seeking, it should challenge stigma and be communicated more effectively, and its uptake encouraged. So some people are too afraid to seek support. That needs to be changed. Interventions need to be fundamentally primary rather than tertiary. So we talk about, you know, building resilience in workers. I talk about building resilient organisations that don't cause a demise in the mental health and well-being of the workers. There are some particular interventions that seem to be successful. She says that more prospective longitudinal studies are required to assess the mental health of doctors over time. We're involved in some of this research. And this last one, I think, is important for you, to build a culture within medicine that explicitly recognises how the job can impact on the well-being of doctors. There's so much evidence now to say that jobs can affect mental health. That's a given. And promotes mental health and self-care from the first year of medical school, with the deans, the trusts, the Royal Colleges being responsible for developing and communicating evidence-informed initiatives and sharing best practice. So, you know, this is the profession that is based on evidence, so why don't we use evidence-based approach to improving the working circumstances of this profession? So some research that we are planning to do in Australia, if you're interested in trying to cooperate with this research, Paul Ward is our leading investigator, trying to look at the understanding and preventing suicide and mental health problems in doctors, and I think also focusing on people that are left behind when a colleague does commit suicide. I think it's a profound effect on the psyche of people that are left behind as well. A psychosocial safety climate is being used as a as a requirement in the minimum data set by the Victorian public sector. When you measure performance in an organisation, they're saying you should also measure psychosocial safety climate. It's being used by the Victorian Public Service Commission in their People Matters survey, has been used by the Australian Public Service and many other organisations. So what we're thinking about is a new project which it would involve this profession. So you can go online, fill out something, fill out those 12 items and get a score, and then you can get information about what that means in relation to the national standards. And what I would like is, wouldn't it be good if we had a project which looks at every time somebody comes into the clinic that is a worker, first and foremost, we get them to fill that out and we get an idea about the psychosocial safety climate of the organisation. I think that it is the case that there is a limited amount of time, there's not much information, somebody's coming in, you go through what the problem is, but unless we've got some sort of objective indicator about what it's really like in the workplace, we're really without, maybe some of the most important information. So there is a meeting, ANZON meeting in Adelaide later this year, and maybe we could have like a roundtable to discuss what a research plan would be, where we engaged occupational physicians and GPs to actually get their patients to do this, and then this information is brought in, and then what would you do with that information? How could you advocate on behalf of the worker? And then what sort of constraints do you face then? Because I know there are many. Oftentimes I go to my GP about some sort of medical problem, and then he asks me what I do, and we end up talking about this stuff. Costs me a fortune, but it's very interesting, and we could have more of those sorts of discussions, because I think we share a lot of common concern, but just actually how to implement some of these things is very tricky. And so in conclusion, the economists of a capitalist kind have too much to say in running the world. They really do. Somehow or another, they have been running the world, and we need more pro-social influences in decision-making, in policy-making, and that means you and me. Psychosocial safety climate is an important theoretical construct that links the external social political pressures with internal organisational functioning. It's because under a capitalist system, there's always going to be pressure to reduce costs, to improve profits. That means creaming off from the labour profits up to the top. I was unfortunately taken by ambulance to a hospital in Leiden in the Netherlands just recently, and the healthcare was like awesome. I haven't had the same experience in Australia, so I can't draw any major comparisons, really, just what I read in the newspaper about ramping and things like this. But I was immediately taken in, and I was dealt with immediately in the neurology section very rapidly. And one thing that I learned when I was there is that public sector salaries are tethered to that of the Prime Minister. So nobody earns more than the Prime Minister in the Netherlands. Now, this just means that there's going to be a lot of free-flowing resources in the public sector. This is not the case in Australia. Our public sector workers can earn a lot more than the Prime Minister. All the ministers of the departments that we're working with would earn maybe twice as much as the Prime Minister. And the Australian, Vice-Chancellors, the Australian Vice-Chancellors are earning, $1.5 million a year. It's an outrage. It really is. And I think, we need to start speaking up about some of these inequities in society. Psychosocial safety climate is an evidence-based leading indicator. It can predict depression, anxiety, all those things. It's a leading indicator, and therefore it's a very efficient way to get a gauge on what's going on in the organisation. And it reflects top management support for valuing the psychological health of workers. I think that psychosocial safety climate could be a KPI for strategic ethical management in organisations. It can be used to contextualise health, as I mentioned, for workers. And just yesterday, somebody from Canada, a physician, asked me, could he use the tool in his occupational medical clinics? And I thought, that's interesting. So maybe we could have an Australian, New Zealand, Canadian, UK study along these lines. And do we have any benchmarks of levels of distress or whatever for this profession across countries? Because when you start making comparisons, that's when governments get a bit twitchy and start to try and maybe change the focus of the policies. So that might be an innovation as well. So in summary, we've discussed contemporary economic politics, work stress issues, psychosocial safety climate theory, and evidence-based implications for organisations. So I thank you for your time and listening, and also invite you to the ICO 2021 conference if you're interested in Melbourne. But thank you very much for your time. It is a huge honour for me to be able to present to you today. Thank you.
Maureen, thank you very much. Thank you for expanding our knowledge on this really important subject, for challenging our views on the current status quo, but also providing us with tools and potential solutions for us to implement. Please, I would love to present you with the Ferguson Glass Oration Award.